Docs on Call, brought to you by OSF St. Francis Medical Center, with your host, Gina Morse.
Good evening and welcome to Docs on Call. Tonight's topic, women's health. We are often quick to take care of others' needs but ignore our own medical issues. Every year, countless women face a variety of health challenges: breast cancer, heart trouble, infertility, and much more. Women's services is an emerging focus for healthcare providers. So this evening, we invite you to join the conversation, get educated, and call our experts with your questions. Just dial 698-3742. That's 698-3742. Let's meet our guests. Sitting closest to me is Dr. Jessica Gingrich. She is director of the OSF St. Francis Center for Breast Health and a radiologist with Central Illinois Radiological Associates. Dr. Gingrich is a clinical associate professor of radiology at the University of Illinois College of Medicine at Peoria and board certified by the American Board of Radiology. To her left is Dr. Sarah Joseph. Dr. Joseph practices with the OSF Medical Group in Washington. She received her medical degree from the University of Illinois College of Medicine at Peoria. Dr. Joseph is board certified in internal medicine. Thanks to you both for being our guests tonight.
Thank you.
A lot of folks may realize, we hope by now anyway, that October is Breast Cancer Awareness Month. And that will not be the sole topic here tonight, but certainly it's a good place for us to start on this first day of October. And full disclosure, my day job is with Susan G. Komen for the Cure, and that simply means I care a lot about this subject too. And so let's begin with you, Dr. Gingrich. A question that came in from folks who were watching our news earlier as a preview story to Docs on Call. This caller was Sandra, and she had this question. She says she has an inverted nipple on the left side. She has a diagnostic sonogram scheduled, but it's not for a little while, and she wants to know what this could be. So obviously, she's a little bit nervous and concerned.
Right.
What would you say to her?
Right. Well, you know, they do the ultrasound to take a closer look behind the nipple just to make sure that nothing is sitting behind the nipple, pulling the nipple inward. Many times as a lady ages, the muscles around the nipple area can kind of relax, and it can cause the nipple just to kind of cave in. So many women over years can develop an inverted nipple, but it's very important if it's a change to get it checked out. We do extra views with a mammogram sometimes, we'll do ultrasound, take a good look at the nipple, and just give some reassurance that things are okay.
Well, and appearance like that is not something that a lot of us initially think of as a potential sign of breast cancer. We're more worried about what it feels like versus what it looks like. But there are things that we should be on the lookout for too, besides inversion, right?
There are. Besides just physical exam findings like feeling a lump, one needs to pay attention to how their skin looks. If the skin ever looks puckered, if the nipple changes, or kind of a raw look to the nipple, that needs to get evaluated. And then there's also development of nipple discharge, but usually that's more associated with benign disease than cancer. So there's many different things that one should look for.
And Dr. Joseph, let's get you in on the conversation here too. You're an expectant mom.
Yes.
And nowadays, we worry so much about what we're putting in our bodies, especially while we're pregnant. What kinds of things are you hearing from your patients regarding these issues, and how do you relate to them, not only as a doctor but as a mom-to-be?
Oh, with what kind of things to put in the body?
Yes.
I mean, I definitely have a greater appreciation for any woman that's pregnant. You know, I encourage all my patients to pay attention to what kind of foods they're putting in the body and to try to focus on, you know, healthy vegetables, you know, anything that's fresh and grown from the ground is particularly good. Also, you know, lean meats and you know, lower in the fats and junk food and all that kind of stuff. And I've been, you know, taking my multivitamin and, you know, practicing those tips extra to try to, make the baby as healthy as possible.
That's right. That's right. All right, let's get to our first caller. Gail is on the line. Thanks for your patience, Gail. What's on your mind tonight?
Yes, I had a question regarding pelvic prolapse. I was wondering what some of the symptoms are and when you can seek medical attention and what some of the options are nowadays for women with this problem.
Gail, thanks for that question. Let's begin first with what is pelvic prolapse?
Great, great. So what pelvic prolapse is, what you're referring to, is the weakening of the muscles of the lower pelvis and allowing things over time, especially in women, to kind of sag down. When that happens, your bladder can kind of change position. So one of the things women will notice is, you might have urinary leakage when you cough, or you might have discomfort in the vaginal area. You actually might have a protrusion in the vaginal area. Those are signs of pelvic prolapse, like you're mentioning, and it could also lead to stool issues, constipation issues.
So when should you seek some treatment for something like that then?
When should you?
Yes.
So whenever you're having symptoms like this that are bothersome, first, bring it up to your primary care physician and discuss the kind of symptoms you're having, and let your primary care physician do an exam and reassure you that, first of all, that it is just relaxation of those pelvic floor muscles. And then your primary care physician may decide whether or not it's appropriate to send you on for referral to a specialist.
Besides a quality of life issue, is there anything more serious medically that can occur because of pelvic prolapse? Is it perhaps a symptom of anything else going on down there?
Well,
so
now, that's why I say bring it up to your primary care physician, because we don't just want to blame everything on pelvic floor prolapse. There can be other things. For if you feel a mass down there, it could be a tumor, it could be something like colon cancer, it could be something more important. That's why I say if you feel any of these changes, yes, it could be weakening of the pelvic floor muscles, but bring it up to your primary care physician.
All right, thanks very much. We're going to go ahead and take a quick break. When we come back, we're going to take more of your questions. You are watching Docs on Call. We're back right after this.